Hi, and welcome to MansMatters, the Erectile Dysfunction and Peyronie's disease Shockwave clinic. Today, I want to talk about erectile dysfunction and being gay. Nobody likes to admit they're having sexual problems, but for many gay men, their sexuality may define them. Many gay men have had to sacrifice friends and family in coming out and making a stand about their sexuality. Gay men historically have been victims of the definition of the word gay. The media and magazines infer that they're ready for sex at the drop of a hat and always in the mood. So, if that doesn't turn out to be a personal reality for a gay man, many assume that they are at fault. An inability to perform leads to acute embarrassment and a reluctance to get help. But many gay men suffer in silence rather than talk about the elephant in the room. But the harsh fact is that just like heterosexual men, over 50% of gay men over the age of 40 will suffer erectile dysfunction, and a further 10% will suffer Peyronie's disease. With Peyronie's disease, the penis starts to curve, and whilst it might not seem a problem in the early stages, and even be novel, this can be severely debilitating and can prevent sex in the more advanced stages. When we are young, erections do seem to have a mind of their own, whatever our sexual proclivity. When we were teenagers, it felt like they were always there, ready, whether we wanted them or not. But as we get older, they can sometimes be a little reluctant, even when they really shouldn't be. The fact is, most men viewing this video has either had or will have periods where they struggle with erections. Sometimes it won't go hard at all. Sometimes it's not quite hard enough to do the job. Then sometimes it fixes itself. But erectile dysfunction, or ED, does not discriminate like society. And for gay and heterosexual men, it eventually becomes a medical issue. There are a few ways that ED can come about, and they're often related to other illnesses. Diabetes is one, multiple sclerosis is another. General circulatory problems are also a common cause. The blood flow to the penis is interrupted with these conditions, so erections are difficult to create. Sometimes ED is the first symptom of a circulatory problem. And then there are the drugs. Both prescription and party drugs, or chemsex, are frequent factors in ED. These are all reasons you should always go to see the doctor when it occurs. You might be saving your life before the blood flow to the heart is affected. Low testosterone might be the culprit, especially if you're an older gentleman. It can be just as concerning to find out your ED is caused by psychological issues. But just because you have psychological ED doesn't mean your mental health in general is at risk. Most importantly, there is plenty of help available, regardless of the cause. There are many treatment options available to men, ranging from the well-known pills like Viagra, to penile pumps and traction devices, and injection therapy, through to permanent surgical implants. But a new groundbreaking treatment, focused shockwave therapy, can create permanent improvements. Focused shockwave therapy is now the gold standard for erectile dysfunction and Peyronie's disease treatment, and is widely discussed in our other videos. Focused shockwave therapy creates new and repairs existing blood vessels and rejuvenates nerve tissue, leading to fuller and harder erections. It also breaks down plaque in Peyronie's disease, which causes the bend in the penis. To learn more about our erectile dysfunction shockwave treatment, visit our website at mansmatters.co.uk and check out our YouTube channel's videos Erectile Dysfunction Cure and Peyronie's Disease Cure. These provide a comprehensive overview on all options of treatments and a detailed animation of the shockwave therapy.